Good evening, everybody. Thank you for joining us for the postponed version of last week's presentation of AcuCongress Training Session 3, the Federal Fly-In Advocacy Training. This is about the district. This is a very deep dive, and actually, this is my favorite training session always. Before we move from this first slide, AcuCongress had a meeting with the American Alliance of Acupuncture. Michelle Lau is the president of that. Michelle Lau is arguably the single most important person in acupuncture federal legislation. She has been doing this for the last 25 years, and she is the true epitome of what I call grass tops lobbying, in the sense that she can probably pick up the phone and get any legislator she wants on the phone. And she delivered as always. I've met Judy Chu a half dozen times in the past. I primarily work with the office with her legislative director. But I would tell you that Judy is very excited about what AcuCongress is doing. And she gave us some marching orders. We asked what she needed, and she told us. So we got very lucky on this. Okay, so what's the goal? The goal, according to Judy Chu and her legislative director, is we need 100 co-sponsors in this congressional session, which is the 117th. Why are they looking for 100 co-sponsors? Well, because you have to have enough co-sponsors to show that there is interest by the members of Congress to strip that language in a standalone bill and make sure that it's placed inside this large Medicare expansion bill. It's what Judy Chu on the call called a Christmas tree bill, because they're huge, and oftentimes it takes much more effort from any sort of opposition to have your language stripped from a bill that's that comprehensive. Large omnibus bills rarely, once it makes it past markup, very rarely can you have opposition forces who are going to try and do something about that. Hard targets are the people that we're going to be pursuing for that 100 co-sponsor list. Everything that you see in red and blue, it says Republican or Democrat, and they are, but they are also people who sit on either Ways and Means or Energy and Commerce. Those are the two committees that we're going to be dealing with as we get into this process. Ways and Means has direct oversight of CMS, which is what makes them incredibly important. Ways and Means is also really important because they control the finance for every bill. And so you do, no matter what you pass, there has to be a way and a means to get it implemented. And so that's what Ways and Means is. On the Senate side, it is Senate Finance. And then, of course, there are processes like appropriations, which Blake and I had to have a fly-in in the middle of. I don't recommend it, but everything goes through appropriations in order to make sure that we understand what it costs the federal government. Energy and Commerce has oversight over healthcare, and both of them on the Senate side, by the way, that's the Senate Help Committee, which is Health, Education, Labor, and Pensions, pretty broad-based committee. And then within these committees are subcommittees. All of them have a health committee or a healthcare committee. And so what you're seeing are these red and blue targets. And it's not necessarily that we don't have AcuCongress representation. It's just in this particular type of heat map, I can't do both. And so I wanted to point out how many we were seeking that were committee members. Those are the hardest targets. Then when you see these in yellow, so by the way, the green, we only have two, we have a sponsor and a co-sponsor right now. We have Shelley Pingree, who has signed on a couple of weeks ago. All right, we want you to arm yourself with data. I cannot stress the importance of research enough as we keep going down this path. You are going to want to know everything about your district, everything about what might interest your legislator and their staff members in order to convince them to co-sponsor this bill. So we're going to show you techniques to be looking up information on the 65 and up population. Obviously, the census is the easiest way to do this, but there are other ways as well. You want to also be looking at disability information. So Social Security disability insurance is an enormous population that CMS has to cover. And so it's not just our 65 and up, even though this is specific to acupuncture for our seniors, it also includes whatever Medicare would cover. And in this case, that would be disability patients as well. We're going to have you looking up opioid statistics, which are relatively easy to find. We might have some, obviously, we're going to turn to the NIH and the CDC, but I think given that Blake is a researcher in his field, and he's also a licensed acupuncturist, and he's a naturopathic physician, he may have some fun stuff that we can be looking at too. You want to know what your legislator, their bio, their causes, their voting records, who pays them. You can find all of that information out, and we're going to go in depth on that as well. And then, of course, staff interest, which in this day and age are not hard to find. So we will give you tons of resources to be looking these people up. And hopefully, because we are going to assign some homework tonight, you will get a chance to do that, and you will consider it important for you moving forward that you know this information well enough that you can create a very authentic conversational environment where you're literally just doing a dance with these people. Everyone here is a human being. And the way to treat them like a human being is to not be nervous, to not be worried about whether or not you're getting the script right, to not be worried about whether or not you're getting all the information out, to not worry about who you are in relationship to them. And the best way to do that, again, is to arm yourself with the data you need going into these meetings. Blake, do you have anything to offer on that?
Yeah, so just this week, I've participated in a federal fly-in for the naturopathic physicians groups. And one of the things I'll say is this staff interest is one of the best ways to get over that nervousness. What you'll learn and see is that if you can do just a little bit of a deep dive into the staff member who you're going to be meeting with, and you will be told who your staff member is that you're going to be meeting with, unless you're meeting with the member of Congress themselves. But if you can say, oh, you're from this town, you're from this area, you went to this institution for, undergrad, or for, many of them will have an MPH. And so if you can have just a little bit of that human connection, that will be one way to ease a little bit of the stress that you might feel. And make the interaction just a little bit more organic.
What do you know about your district? Honestly, I mean, I think that we suffer in this industry oftentimes from constantly talking in a bubble, right? We talk to our colleagues, we talk to our patients, we talk to our family members who love acupuncture. We don't always know what else is going on outside of our own bubble. And so the homework that we're going to be giving has to do directly with the district, because right now our members of Congress are at home in the district. And so we're going to be asking that you guys reach out to the district directors. I do want to say this: district work is different. It is about establishing a relationship. They primarily handle campaigning, finance around that, and that is very separate than federal issues that you're going to be seeking to influence. And the two do not necessarily meet, but the importance of knowing how to reach out to your district and who's in charge there could mean the difference between you getting a meeting with congressional staff members and you getting a meeting with that legislator. The district representatives often have very close ties to their bosses, just like the legislative directors. It's just that when you're dealing with federal work, they are inundated with issue-oriented conversations, and therefore your closer relationships, the ability for somebody to pick up the phone and ask if this legislator wants to be involved in those particular conversations, that could, in fact, tip the scales as to whether or not the legislator shows up. So we often recommend that people get to know their district managers, that they get to know the office pretty well, and that they become known to them. It's really important for you to recognize in your district how you fit in. How do you fit into the society? And how acupuncture fits in. If you have a district that is very, very heavy with 65 and up population, happens to have, I'll just use my former district as an example. In Frederick, Maryland, it is at the crossroads of I-95 and 270. It's basically what's called the heroin highway. And it borders West Virginia, Ohio, Pennsylvania, just right tucked up there in Western Maryland. And so our opioid statistics, the deaths were doubling every single year. Well, that's important when I want to sit down with any member of Congress to know not only that I had an issue with regards to this being a heavily affected opioid area, but also because it's close to a school, it has a metric ton of acupuncturists. And to find out that the sheriff doesn't want people detoxing in his jails, and he doesn't want to see them as criminals. He wanted to see them as patients. That kind of information being spoon-fed to my legislator was the defining reason he actually jumped on and supported the prior act that had to do with veterans, because we also have a heavy veteran population that happens to be addicted to opioids. So these are the types of things that we want you thinking about. You're going to get to know your district. And I've got these maps up here because we've already done the district analysis for the number of acupuncturists in each district. And so you're going to have that information as well. There's a lot we'll spoon feed you. And I believe that when you do your own research, you have more skin in the game. It actually is something that you've embodied, and so you can remember it easier. And it makes you usually a little more comfortable when you sit down to have conversations that are legislatively oriented. Blake?
What I want to bring everyone's attention to again is what we said, I think it was during our very first training, is I am a constituent and I vote. And just remember, like, your constituent and your vote isn't this power that you're leveraging over your member of Congress. What you're doing is you're saying, I have a vested interest in the betterment of our community. These are people who you are, again, demonstrating that you know the issues that are at hand in their areas, and you're wanting to potentially work toward a solution with them. If you come at these conversations from that perspective and come at the research that you're going to have to conduct from that perspective, you're going to embody it much more, and you're going to understand just how much of an impact what you will be going and asking them, how that will, if we want to say it, trickle down back into the specific area.
Right. Here we talk about why we're starting with pain and opioids. We want to meet your legislator where they are at in this journey. I cannot count the number of times I've been dealing with integrative healthcare practitioners who want to use their own language, appear in those meetings with their own agenda without understanding that, there's some education pieces that need to be discussed, but also just to have something in common with them, you need to understand that most people on Capitol Hill don't know a lot about acupuncture, believe it or not. And what they do know about it is related to the Support Act, which has to do with opioids. That was the opioid package in 2018 that we got passed, which thanks to Judy Chu and Ellen Hamilton at her office, you now have acupuncture as part of the legal lexicon. It's very important to know that. So while I know there are some people who really get upset over the fact that we're still focused on the opioid crisis, recognize a couple of things. One, chronic pain, I think there's a staggering statistic that 100 million people in this country are affected by chronic pain. And we know that acupuncture is good for pain, but also that this opioid crisis, which used to be the shiny object in the room, always, it was a great way to get legislation passed because it is a crisis. It is an absolute American epidemic. I'm sure it may be an epidemic elsewhere, but for our purposes, it didn't go away during the pandemic. In fact, it got worse. It's just taking a back seat with regards to press coverage. So we want to start with opioids and with pain. The other side of that too is we're very unique in integrative healthcare circles and among practitioners in the sense that we not only can treat chronic pain, which so can physical therapists, occupational therapists, and chiropractors, but they don't treat substance use disorders. And we have a significant body of evidence that states that not only do we treat it, but we do it quite well. Blake, do you have anything to offer?
Two things. One, we even have states that have specific licenses for people to treat substance use disorder, period. Looking at Georgia as a state that I've hailed from, and they have auricular acupuncturist technicians that can treat only SUD. And that's it. So this is huge. People are recognizing the area that acupuncture can plug into. But when we're talking about data culling and data accrual, you want to understand what's happening at a federal level, at a national level, really would be the terminology. But you want to know what's happening across the country. But when we're talking about your district, when we're talking about your state, you want to not only keep in perspective what you're going to find from CMS and NIH, who have the greatest amount of data, again, nationally on both prescription rates and opioid-related deaths, but look at your state health authority. That's going to be your first go-to when you're looking for these data. Your state health authority will have, because most states have a PDMP, which is what providers who prescribe opioids, they have to register and then track their prescription rates. Look for your own state authorities data, and that will be just a quick Google, and that will give you the best perspective.
I would add this, that prescription drug monitoring programs started to increase at a huge rate. Legislatively, they were swept across the nation. Also, he mentioned your AcuDetox specialist, NADA, has been pretty prolific. I believe there are 36 states that I know of that have specific substance use disorder positions that have to do with acupuncture. And I recognize that that can be controversial too among this industry. That being said, that's not what we're going to worry about here. What we care about is there's a body of evidence, and then there is precedent for state licensing or state registration for AcuDetox specialists. That actually helps your case moving forward. And then the last thing that I wanted to say is Blake is right. You can find state opioid information, but you can also find it by county, and you can find it by congressional district. And these are different places, and we'll get into some of these places that you can look for research. But one thing that we have been great at is documentation in the opioid crisis. Starting at about 2015, it is a heavily documented state of affairs. Disorder it doesn't even begin to touch what this crisis is. And so because it is such a big deal, there is a plethora of information available to you. And you want to make sure that you're well versed in all of those statistics. What is important to CMS? And let's just make sure everybody knows that CMS is a Center for Medicare and Medicaid Services. Medicare is your socialized medicine 65 and up. It's one of the largest social programs that we have federally. So, Medicaid is state run, so funded federally by CMS, but oftentimes you're dealing with apples and oranges with regards to whether or not you take part in Medicare. Doesn't matter with regards to whether or not you take part in or take Medicaid. So don't confuse the two. I know that people get, one is about an elderly population and the disability. The other has to do with vulnerable populations that deal with lower income individuals in our society. So Medicaid historically doesn't pay very well at all, but we are lucky to have a dozen or so states that have acupuncture specific Medicaid waivers. And obviously we want to spread this medicine to whomever we can. We know that people who suffer from chronic pain oftentimes fall into vulnerable populations. And so, but don't get the two confused. One is about Medicare, and that's the federal legislation that we're looking to change. So what is important to CMS with regards to Medicare? An elderly population, but I want to put this bug in your ear. There is a strong push, especially with regards to people looking at Medicare for all, of a set of Democrats who also would like to see Medicare extended to people who are 50 and up. It's not got a lot of traction, but it's definitely out there. So just know that right now we have a 65 and up population. That could change. It will not be changing anytime soon in this congressional session. And then the second thing is disability. So once again, you want to pay attention to your veteran populations in your state. You want to see what disability statistics you can pull. It's very easy to go through CMS data and look for what they've already captured. They are also quite prolific at statistical data gathering and distribution. So all of this stuff is available at your fingertips. It's just a matter of knowing where to look and knowing specifically what's important to CMS. Blake?
The only thing is I want to put just a little bit of a lighthearted aspect to this is that ever since I started in my advocacy work, it always made me mad that it's not CMMS because it's supposed to be Center for Medicaid and Medicare and Medicaid Services. But once you get into this, and I'm sure that many of you already have this rolling off your tongue, but once you get into it, it becomes much easier. And Callie is very, very correct in that if you want to be overwhelmed with the level of data available, go look at CMS. They've got it.
All right, so I put this in every single presentation that I have because sometimes the audience is different, and if it's not, you still need to know this stuff. This is the resource list. We will, a lot of this stuff you've already seen, especially if you're looking at staffers. That's as simple as I usually look at LinkedIn because those are their professional bios. But oftentimes they'll post their Twitter handles. They'll post where you can find them on Facebook and Instagram, and Google is a wonderful thing. It always has been. And then of course, we're going to go through each of these ones for the information on legislators. Well, most of them anyway, specifically. So I don't want to spend a lot of time on this slide, but just know that we will post. It's always in my presentations. We will strip that out directly and put it in training materials and a resource list for you guys. All right, Bill Track 50. The reason I use Bill Track 50 is you can start a free account. There are lots and lots of tracking apps and tracking sites for legislation. I like this one because I know the owner and she's fantastic and she's really, really passionate about giving as much access for free to people who need it. There are a couple of things about Bill Track 50 that I want you guys to focus on. Obviously, you can focus on bills, and this free account is perfect for you guys because you're really just looking for acupuncture. And I have pulled up the federal one. The fact is, if you're going in to look at legislation, you can search bills. Do not put Washington, D.C. in there. You're going to get D.C. bills. It is United States that you're going to be using. And so otherwise you can just put all states and you'll come up with, I believe there were 290 pieces of acupuncture legislation nationwide as of about 11 o'clock this morning. But also you can look up legislators. You can put your legislator search in. Again, you want to put in United States so that you are not, lots of people have very similar names and you don't want to have to pilfer through those. The example that I have here, the reason I've pulled up the legislator, if you scroll down, there are a few things that you can look at. You can look at the bills that he sponsors. You can look at how he votes. You can look at what committees he serves on. This is an excellent way to get familiar with somebody's staff. And nothing is a secret. You will know exactly how to reach out to these people directly. One of the things that you see below Rachel's name, Rick Leonard, is the district director. That's who you're going to be looking for. So when we give you the homework to reach out to the district, we want you to use Bill Track 50. Don't worry, we're also going to pull and export a list of all the district directors in all 435 districts for ease of use. So you can just click on your district and your legislator, and you'll have that district director's contact information for you. And there's so much more information. As you see, they give you links to social media, so you can immediately connect with your legislator that way. Blake, do you have anything?
The only thing I want to remind people is, if you are new to this and you are going to meet with a senatorial office, don't expect to find a district director.
That is fair. No,
don't freak out if you don't see a district director for a senatorial office.
Thank you for saying that, because Blake knows me well enough to know. Blake loves the Senate side, which is what makes us really good partners in crime. Because I am primarily what I like to call a house rat. So I spend all of my time on that side of Capitol Hill, and I let Blake spend all of his time on the Senate side. And yes, with 2 senators, there are no district offices. And recognize too, you're going to get 1 district director here. You may find an office with several district offices. And so what we'll do is work to find the information for the one that's closest to you, or the one that's best for you to reach out. When you oftentimes see 1 district director here, they probably hold an elevated status in an office that legislator works primarily out of. Okay. All right, Ballotpedia. I like Ballotpedia a lot. It's a ton of information, and a lot of the times you're going to find very similar information that we're asking you to, which is why I said start with Bill Track 50, because you may just find what you're looking for. But there's a few things that I like about Ballotpedia. One is their analysis. I really love, like, if you look here and they talk about ideology and leadership, Tim Ryan is considered a rank and file Democrat. He primarily votes with his Democrats. That is not to say that he's just sticks that way, because he actually is very, very good at crossing the aisle. But it also shows you like-minded colleagues who they often vote with right there. And they're giving you both a Republican and a Democrat there. And if you were to click on that information, you would have more information about those types of things too. Who they least often vote with. That's always good to know too. In case you're deciding you want to name drop in an office and you decide, I don't know, let's say Jeff Duncan is who you want to name drop, or that's your way in. The fact is, he does not tend to vote with Jeff Duncan. So maybe we just leave it off the table. There is a donation concentration metric that I really, really like with Ballotpedia. And it will break down, primarily the types of industries that are contributing to him, that you'll see exact amounts. And most of that information used to come from Follow the Money. I don't know if you know this, but Follow the Money is no longer there. So, and then key votes. I think these are really, really good too, because the graphics are nice and they break things down for you pretty easily. So, with an up or down vote, how that went, and you can start searching for how they have voted in legislation that may be similar. And any integrative health care bill, standalone or otherwise, is something that you would want to look up and see how they voted and what they thought about it. Do you have anything to offer on Ballotpedia, Blake?
No.
No,
I was just I'm putting myself back in my first time I was ever receiving training in this, and hearing all the different assignments and research and deep dives that I needed to do and that we're asking you to do. And I want you to realize these are the pieces of information that will, again, get you familiar. This is not what we're going to be quizzing you on, ask you to rote memorize and word vomit back to us when we see you in person. And we're not going to ask you to spew this out whenever you go into the meetings either. This is for you to really just, again, get into the mindset and understand who you're going to see when you go into these meetings.
Yeah, you're a voyeur into their lives. These are public figures, and this is the opportunity to get to know them. And that's what all of the research is. You're getting to know somebody, and you can tell a lot, not just about the way that they present themselves when they're on camera, but looking at who supports them, how they vote, who's donating, who they take money from, their special interests. These are important things to know. So there used to be this site that everyone quoted called Follow the Money, and I loved it. I loved it because everything is public record. And so now it's called Open Secrets. And there was an Open Secrets prior, but it did appear that they were kind of doing a lot of the same thing. So they have now combined efforts, or I don't know, maybe Open Secrets just bought out Follow the Money. There is a breakdown by contributors, by industries, by PACs. It'll give you demographics. There's so much information on this site with regards to campaign finance, and it really does set you into the mindset of why people vote the way that they do. Are they being heavily contributed to by people who we might be considering to be opposing forces? I don't know, but everything is public. So if you look, there's the industry. They break it down. He ends up getting more money from, it looks like retired is what it says. So that's going to be AARP more than likely, but it could be individuals. And then if you look at the top, it actually lists the contributors by name. So you can see a breakdown of who has given the most to this candidate and what industries they're from. Please get familiar with that. You do want to follow the money. You want to know who you're dealing with. If for no other reason, then I oftentimes put people in meetings and they make the mistake of bad-mouthing another industry. And that industry is a heavy contributor to the legislator that they're talking to. That's a deal breaker, guys. They won't consider doing anything for you because you've just insulted an industry that that has given a ton of money to their campaigns. So please, please take the time. You can get, maybe you can skip Ballotpedia, but Open Secrets is highly interesting and definitely something that you need to get familiar with. Blake, do you have anything there?
A quick reminder, as you just hinted at, just like with your patients, when you walk into these offices, you leave your ego, your opinions, your judgments at the door, and that's it.
Right. That's right. Yeah, I do. I mean, no truer words ever spoken. I think a lot of people, they do one of two things. They either cower in the face of these meetings where they feel like they don't have the right to ask for what they want, or they go in a very different direction, which is not going to get you anywhere. And that is to kind of throw their weight around. Or they have an inability to read their room, or they haven't done their research. And if you do your research, then there will be fewer missteps as you move into these meetings. On the issues, I touched a little bit on this the last time we met. It's really a great site. I love it because you can pull it up, and just like I've highlighted here, they'll break down domestic issues, international issues, social issues, doesn't matter. And then I just clicked on healthcare, and it will tell me how he voted. It will tell me everything I need to know. Tim Ryan on healthcare. But what I have, and so you can see here, I think the one that I got caught up on, Blake, was focus on working class people who take showers after work. I was like, what? Maybe we should focus on people who don't take showers after work. I'm not sure. But it's coming from a quote that he got into an argument with Bernie Sanders on Medicare for all. And that's how that kind of ended up being listed there. But if you look here, Tim Ryan on healthcare, he, in July of 2019, he wanted Medicare for 50-year-olds and allow buy-in. I'm sure because he's 47 or 48 now, it's on his mind, although they have better healthcare than everybody else. Prevention should be the key focus. He's always been prevention oriented. It gives you an idea of where he stands. But again, if you look at the dates here, you want to focus on the most recent. He's had, they'll tell you how he voted, but then you start looking and it's as far back as 2003, 2004. It's not that that's not important, but he has changed his views on certain issues, abortion being one of them. He entered as a young man who came from a Catholic background, and he has since absolutely publicly stated that he is no longer anti-abortion, which you can find all of that there. If you see there, it says click here for 29 full quotes on healthcare at the very top of that. So do it. And I pulled up the prevention should be key focus. That's what the theme is that they've put into this healthcare, where he's weighed in on issues. But it will give you the whole quote and it will give you the source. And we want to know what they're saying. We want to know how they're speaking about our topic. It's lovely to know that there's a legislator out there who understands that prevention should be the key focus, that he really is focused on the fact that it's not a healthcare system, but a sick care system. And how well do we as acupuncturists fit into a world in which prevention is the key focus? And we could save them money in terms of healthcare cost. And that would, if you continue to read that quote, he talks about how even Kaiser has said that if the focus was prevention, it would save them 40% of what they spend on healthcare to begin with. So look into on the issues. I find it to be a fun site to visit, just to kind of get to know that legislator even better. Blake, do you have anything on this?
The one thing that this reminded me of, and I know that the next thing we're going to talk about is their personal website or their campaign website. But one of the mistakes I made when I was on the Hill one year is that I walked into a congressional office and asked for co-sponsorship on a bill. and they had signed up as a co-sponsor the day before. And I can't even tell you how much I just wanted to crawl in a hole and die. And so there is one tool that I think we have hinted at many, many times. We've shown you things from it. If you ever look up, if you ever just look up, HR 4803, it's going to take you to congress.gov. Period. Right. And so congress.gov is when you're asking for co-sponsorship on a specific piece of legislation, make sure that you check it just like before you walk into the room or into your Zoom meeting and get an update, because they will want to know how many co-sponsors there are, how many are Democrats, Republicans, that kind of thing. And we're going to get into this, obviously, like whenever we go into the ask. But just keep that in mind, that congress.gov for specific pieces of legislation is just one more tool to keep your eye on.
And yes, I actually had a whole slide for congress.gov, and I realized as I was going through it that wasn't even the most interesting parts to me with regards to research. But thank you, Blake, because you're right about that. Congress.gov is what any legislator or legislative staff member would tell you to look up in case you wanted to know how many co-sponsors were there. It'll give you a breakdown of not just who the co-sponsors are, but when they signed up. It is the go-to site for Congress, so why wouldn't it be our go-to site as well? And Blake is right. You're going to want to check these things right before you enter into any meeting, so that you can make sure they're still the same ask, right? If they're not a co-sponsor, we want them to be. If they are, then this is just a meet and greet, and you get to relax a little bit and thank them for being a co-sponsor of the bill. So thank you, Blake. I really do appreciate that. All right, their House websites. The reason I say name.house.gov, that is going to be the easiest way to find them. It's usually their last name. In this case, it's actually Tim Ryan, because there used to be a Paul Ryan, if people recall, the Speaker of the House, former Speaker of the House, that would not have gotten you to the same place. And so in this instance, we have Tim Ryan.house.gov. All of them will end with .house.gov if you're going to look for the House of Representatives personal congressional websites. These are great sites to start. Please start there. The reason is they've taken the time, or they've at least allowed somebody to put this together for them. It does give you a really interesting look into their personalities and what seems to be important to them. You can look up resources, you can look up services they provide, you can find all of their district information. That will usually link you to census data. So before you start doing massive Google searches, you want to check and see if this site doesn't already give you that. Moreover, it tells you what they already know and what they think is important about their district. Their bios are usually more extensive on their own sites. And Blake actually touched on something. There is such a thing as having regular congressional websites and campaign websites as well. Both are important. I do have a tendency with incumbents just to stick with their congressional websites, but you can also find out different information with the campaign sites that they're running too, and we'll give you resources for that as well. Blake.
I was just going to say, just remember, even recently, I think it was either last week or it's this week, that members of Congress are in their districts right now. And you know what they're probably doing is holding town halls. And so if they hold a town hall, I know that this was a huge portion when I was advocating with Georgia. They were holding town halls on how to start integrating alternative practitioners, non-conventional practitioners in to address the opioid crisis in specific districts. If they hold something like that, that's huge. Thank you so much for holding this town hall. What you conveyed was a deeply resonant message. I would love to see more. And if we can help you organize another one in the future, whatever that may look like, just, honor their efforts because they're working.
They are working. And that's also, it brings up something right now. I think somebody recently told a group that you need to be attending fundraisers. Like I said, fundraising and campaign finance is coming out of the district, and that is very different. Do not bring up fundraising to these legislative directors, to federal staff to begin with, because that's issue related. And then the second thing is, they are really good at holding town halls and getting out into the public and coffee. You would be amazed at how much they put themselves out there. And that does not usually require that you spend an exorbitant amount of money to attend. Some are free. Some are nominally costs, or have nominal costs. You know, this is not, you will never convince me that it's all pay to play. Even in the field that I am in and have been doing policy for almost 25 years, I still am a firm believer that these are public servants, that they work for you, and that the relationship needs to be had, and it doesn't necessarily have to come with an exorbitant cost to you. So while they're in the district, see if there is any sort of town hall, call that office, find out if there's the ability for you to go in, find out if, and I know I hesitate to start sending people out into the world in the middle of a pandemic. So please be safe as you're doing this, and then recognize that they too are worried about these types of things. But you will find that they are available while they're in district. Guys, they don't go home just to sleep. They go home to work. So it is the only times that they have a connection. And for the record, healthcare is one of the most contentious issues that started causing a lot of people back when Clinton was in office to stop holding those town halls because they were getting lobbed at, just people were very passionate about showing up. And we do want to be passionate, but we want to show up compassionately, and we want to offer solutions, and we want to be where it's appropriate. We want to be thankful for the work they've already done, and we want to educate them as much as we possibly can. The slide says the power of social media. It should have probably said looking up staff, but essentially, social media is where you're going to find your staff members. You will find them on LinkedIn, almost all of them. I like that better because you have to remember that a lot of these people are beholden to the office that they work for. So they're very guarded on social media about what they put out personally. So even when you're looking at Twitter, Instagram, Facebook, what you're often seeing is still a public face on the issues. And so LinkedIn seems to be where they're most comfortable talking about themselves, where you're definitely going to find a bio. You won't necessarily find that in Facebook, Twitter, and Instagram, right? You'll find out how they post, but that doesn't tell you everything that you need to know. If you're really looking to find their professional backgrounds, what led them there, then the best thing that you can do is be looking at LinkedIn. And in fact, we do that for every meeting. We make sure that you have access typically to the LinkedIn bio that you're going to be of the person that you're going to meet. And why is this important? I can't tell you the number of times that I have changed course in how I was going to present based on the bio of the staffer that I'm meeting. Knowing that in DeGette's office, that her legislative director has a degree in nutrition made a huge difference in how we were presenting for an issue regarding naturopathic physicians, because we understood that with a background in nutrition, he probably knew or was interested in the herbal piece that we were presenting. And as I recall, Blake, that was an easy person to get to sign on. We met him exactly where he was. And if we had not been armed with that information, I can tell you that we would have wasted 10 of those 15 minutes trying to feel him out. We got right to what we needed to do on that. And I recall that just being one of the most fun meetings that we ever had. It was 3 minutes of him recognizing that we knew who he was and we could see him for how he got there and what was important to him. And then him saying, yeah, I'll sign on. And the rest of it was 12 minutes of just bantering back and forth like we were colleagues. So please use LinkedIn, because again, those bios are really what you're looking for. The Twitter, Instagram, Facebook, those are good ways of seeing how they post, what they want to post, but it doesn't really give you all of the information that you're looking for.
I do want to point down to Legistorm, this very last one. It helped me a lot just this week, meeting with legislators, because two things that you will need to realize is that we say that these aides are making pennies. They're literally making pennies. Like, we're talking $25,000 a year salary. So keep that in mind when you go in. But I got to see the aide that I was working with that day is from my favorite part of my state, and that they have a master's in public health. And I said, I know that you're going to understand some of what we're going to talk about today because of your, educational history. And the one thing I'll also hint at is don't be creepy. Don't act like you really have gone through every single one of their tweets and everything else. Like, have an open-ended question. If you think that you're going to be able to build a connection with someone, say, can you tell me where you're from in the state? They may not be from your state. Keep that in mind too. But can you tell me where you're from? And they'll say, oh, I'm from Burns, Oregon. I'm like, that is where my favorite, like the desert that I love to go and soak in the hot springs is. And who's like, oh my gosh, nobody knows about it. And then you're able to, again, relax a little bit. It becomes more genuine, and you're going to have a much more easy flow for the rest of your meeting. So
that's right. That's right. It's about being curious. Don't be creepy. That being said, it is your job to look them up and to find out. Legistorm is something that I was going to bring up. If LinkedIn doesn't get you where you need to be, Legistorm is fantastic. And right down to, Blake is right, these people do not make a lot of money. These are some of your more powerful people on Capitol Hill, but they don't make a dime, which is why it's always important when we hold congressional briefings to feed them well, otherwise they're not coming. And to recognize that they work really long hours. It is not uncommon for congressional staff to reach out to me at 9, 10 o'clock at night, and they are still in the office. And again, they don't, unless you're a chief of staff, you're not really making the big bucks. And that's not what they're doing this work for anyway. They're doing this because they have a love of policy work as well. But it's very important to know who you're talking to. And then I'm going to touch on one other thing, and that is, don't ever think you need to treat every single member of their staff as if they are the most important person. And let me tell you why. That scheduler might also be a legislative director, right? There are no secretaries here. There are no unimportant people who are staff members. Yes, occasionally you're going to be meeting with interns, especially if we hold fly-ins in the summer. And I don't mind that at all, but it's pretty clear really quickly, they're not going to get you anywhere you want to be. So we do push for people to be meeting with their legislative directors and or chiefs of staff or whoever is going to be a decision maker in this process. So make the assumption that if you are talking to somebody, they are not a low man on the totem pole. Okay. They, in the same manner that they love their bosses, their bosses love them. So, I have a terrible story about a Michigan State House that I could not get a meeting in after I decided I would throw my weight around in my 20s and talk to a scheduler in a way. And I was furious. I let it be known. And it turns out that scheduler was really close to every other scheduler in the Michigan State House, and she had an axe to grind. So I spent a year being in the doghouse. in that state, and had to send in a different lobbyist that did not have my last name, because I had made the grave error of assuming that it was okay for me to talk to somebody as if she did not have not only access to that legislator, but access to every other legislator and every other staff member of other legislators. So be very careful when you're talking to people. Make sure that that you keep your own feelings in check, but also just do your research. If I'd done my research, I would have, well, you know, maybe I wouldn't have that story to tell you guys, and then I couldn't regale you with my own personal trauma in this field. The research that you're doing is as much to protect you as it is to arm you with what you need to have a very successful meeting, so that you don't put your foot in your mouth or you know, say something that you don't know whether it's going to land well or not. Okay. We're going to move directly into roles and responsibilities for AcuCongress. We touched a little bit on state captains and district leaders prior to this. Each district will have a leader. If you don't have a lot of other people in the district, you are it. State captains, we are looking for a little more influence here. We want them to kind of oversee the district leaders, make sure that everything is running smoothly, and then be able to sit in on meetings potentially where we don't have anyone. State captains, it is assumed, whether they are in the district or not, they're representative of AcuCongress, and they can sit down just as easily as any constituent. You will be obviously required to do the homework in each of those districts if you decide to do that. And if not, we'll figure it out. We're researchers, you're all in charge of your own research, but if you've got teams and somebody is really good at it, divvy it up, let them do that. You know, if this is something that they feel like, you know, I don't really want to speak, I get nervous, but I'm happy to do a lot of this legwork, let them. Of course, you know, so those are the roles that we're going to be looking. You know, you want to define who your district leaders are. We'll have the state captains for you. Researchers are very, very important. And the expectation is everybody is doing their own research. However, I've watched this happen, especially in larger district teams. You've got everybody doing research. Well, they're all coming up with the same information. And that is a waste of everyone's time. So talk to each other, find out who's good at this. Some people like me, like Blake, love research. I'll do it all day long. I absolutely love it. But I do know that for others that is such a turnoff for them. So they hate it, and they would probably benefit greatly from somebody stepping into that role. Timekeepers are the single most important person in these meetings. You have to stay on top of your time. And I can't tell you how fast it'll get away from you. You will have a strong personality who has decided they're going to jump in, and they start talking about things that are important to them. They can lose the entire room. And if somebody isn't adept enough to not only keep time, but encourage people to stay on time, you kind of have to have a dominant personality for this particular role, because you're not going to be speaking, you're not going to be conveying. This is a very technical position on this team. And again, probably the single most important one, because I've actually watched a 15-minute meeting turn into a 15-minute moment for an MD who decided he was going to talk about himself for the entire 15 minutes. And if there had been a timekeeper in the room who was willing to stand up to him or knew they could do so, because that's what the role and the responsibility of that role was, then that would have been a very different meeting, a much more productive meeting. And that's not to say that that was something that the MD did wrong. It's just people get so accustomed to trying to justify why they're in the room. You don't have to necessarily do that. And if you had a timekeeper in place, they would definitely move it along. Content managers work in tandem with the timekeeper. So content managers aren't necessarily paying attention to the time, but they are paying attention to how the messages are delivered. And so you'll have a script, that may not be the right word. You'll have a general idea of how you want things to unfold. You'll have an agenda, if you will. It is up to the content manager to make sure that this dance that people are doing, this very conversational, authentic dance, does have some design. And so if there are things that are incredibly important to be including in these conversations, then you want to make sure that it doesn't get left out. And also the content manager is going to be responsible for making sure that if it doesn't get touched on in a meeting, that we know this and that we will put it together in a package for follow-up to make sure that these topics are addressed. Like, I left one off. I knew I was missing one today. Speakers are there. They're very important. You're going to have to determine who has the best story as patients, what testimonials are going to move that needle enough, who presents very well, right? Not everybody is comfortable presenting. So you want to designate your speakers. And I'm also going to tell you that sometimes people who think that they speak very well and they have a story to tell, don't. And so it's not their fault. It's just that it doesn't come out the way that they think it does. So you want to make sure that as a team, you've chosen exactly who's going to speak. Do not waver from that, and do not let your meeting get hijacked. And that will be because the timekeepers and the content managers are doing their job, that the district leaders are guiding and also providing that Zoom call. And that's the beauty of them providing the Zoom call, because when Blake and I did it, and we had to have so many happening simultaneously, nobody could mute anyone at all. As a district leader or a state captain, you do have that ability. Blake could mute me right now, and he has. So
I have. And what I'll say is I'm gonna pull a content manager real quick, because this is, Callie said, one of, if not the most valuable position is the content manager. If it is getting slightly derailed, pull it back to what it means. What you'll hear from some of your staffers is that they'll hint and say, oh, we're just not, this is something that we can focus on or not something we can focus on. Or contrarily, if you say, oh, this is getting derailed, but we're going to tie this in because I know that your Congress member is on the committee for blah, blah, blah. And we think that this ties in with its effort. Making sure that they can keep to the theme, direct, and so timekeeper and content manager may end up being the same person, but making sure that it guides in, becomes into like the end, ask, and conclusion.
Right. Direction or deflection. I mean, these are things that actually happen.
Exactly.
As you're delivering content, we always want to make sure you guys understand, we're not kidding when we say do not lie. Do not lie. If you have, if you've been asked a question and you don't know the answer, just say, I don't have the answer for you right now, but I will follow up with you as soon as I do know the answer. It's actually a great, I love questions that I can't answer, because then I do get a chance to follow up. What I left off this slide, and I guess we'll just add it here, observers. Please don't think because you didn't speak, research, keep time, manage content, weren't a district leader, or a state captain, that you are somehow unimportant in this process. All of those roles that I just said, they may not be the best observers for what happens in this meeting. I love Blake. Oh, that made me so happy. So the thing about being an observer is we really do need to know, and we're going to ask you, what were the reactions of the congressional staff member or the legislator? We need people who are looking at facial expressions, body language, were they looking off in the distance? Did they seem interested? And I mean, we have a very comprehensive follow-up that you're going to be filling out for every meeting that you have. And then what we found is, people who were fulfilling some of these roles didn't really, like, they couldn't go back and really remember what their observations were. They knew how they performed, and they probably knew their piece of it. And they could probably tell you how they reacted to certain things, but they couldn't tell you everything. So really, if we're being honest, content managers are definitely one of the most important things, but the observers are just, in terms of the feedback that we get, how we interact with that office from there on out. That's why we encourage everybody to recognize how important their roles are. And observer is one of those that I take people aside, and especially in this field, what I love is we are healthcare practitioners, so we are keen observers of our own patients. We know when to listen for when their voice changes. We know when to see when they get excited. We know when to see when they perk up, when they push back, what their body language is. We know how important that is. So I want observers to recognize that we need desperately their feedback, and to treat each meeting as if they're sitting in front of a brand new patient, trying to glean as much information as they possibly can, being an active listener. Blake, do you have anything to offer on that?
No, I was just going to say this last week I served as both content manager and observer, and it helped me so much to sit in and look through everything that I was going to be filling out on the feedback form and be like, oh, like I forgot that we were supposed to like mention this one thing. And so then I was able to go back and say, like, while I've been watching him and making sure that like we're, adhering to all of our content, again, observe and like call somebody out and be like, hey, you didn't like talk through this one point, you didn't do this one thing. Or if you see, their eyes glaze over and like they're looking off into the distance or like getting up and going to get a cup of coffee, be like, hey, maybe we should wrap up this piece and, move along because we're losing them. So
the only thing that I want to add to that, if you were sitting in front of a congressional staff member face to face, you would have to know that these people, much like reporters, have become adept at writing. They handwrite their notes. Always. They handwrite their notes. And they will do the same thing in a digital platform. So if they're not making eye contact with you, which they've become quite accustomed to, I think they actually teach them how to write in a shorthand way while still looking at you. Don't think that they're not listening. You can tell when somebody disengages. And so you want to make sure that you're differentiating between taking notes and actively taking notes, or they've checked out.
very good
You
point.
will also have those, by the way. It is no fun. There are two types of, well, there are more than two, but the main types that you're going to get, especially in this field, is people who are curious, and they want to know about acupuncture, and they want to hear your testimonials, and they're excited to listen, and they're going to take a lot of notes. And then you have those who, they're usually attorneys, I'm not going to lie, who apparently know everything about everything. And so they don't take a lot of notes, and they do ask some fairly combative questions. And so we're going to teach you techniques on how to handle those as we meet in person, because those can actually, they can sour people on being a part of this process at all. And we want to make sure that you get the most out of every meeting, even when dealing with lawyers. What did Shakespeare say? First, let's kill all the lawyers. I think that's what it was. Unfortunately, Capitol Hill is lousy with them. So just know that you're going to have varying types of people that you sit in front of. Okay. The material that we're going to be looking to put into, that you will be responsible for looking at. So you're going to be looking for your Medicare enrollment statistics by district, very easy to find. I can show you how to calculate what the increased rates are, so that you can do a nice little infographic, just change those there, so that, it's different in Indiana District 2. That number, 17% of the Medicare population was increased. I believe it was 19%. You're going to want to know what the constituency base looks like. So that's not just knowing the number of licensed acupuncturists in the district, but also what does that look like in terms of patient representation? There's some assumptions that we can make, but you guys as district members have a better idea of the number of acupuncturists who are operating there. I'm pulling licensee lists, right? You have a better idea working with your colleagues as to what their patient base looks like, who's treating large swaths of people. We know that acupuncturists can't bill Medicare directly. That's not to say that they don't deal with an aging population, or that they don't deal with people who have disability insurance. That's just a billing issue. The Social Security Act is just about how to reimburse people for their particular services and what providers are covered. So we're really relying on you guys to do the legwork on, like I said, I can provide you with the number of acupuncturists by zip code in each district, but we want you to be able to fill in the blanks on what the patient population looks like and how many people would be directly affected if this law changed, and what it would look like if the law changed and we could bill directly for Medicare. How would that change your practices? I think mostly people answer, well, I wouldn't get paid a whole lot. Okay. I didn't say it was a good system, but it is the system in which we are operating. And so that's what we're looking for. And then finally, there's the pain does not pause. That actually was taken from the state of New York when during the pandemic, they had an acronym for their shutdown, which was New York Pause. And our point at ASNI was pain does not pause. So we needed to be on the essential services list pronto so that people, we could have helped hospitals not be overwhelmed with those who were seeking help for chronic pain or substance use and couldn't see their providers. So we are sticking with that theme of pain does not pause. Those are going to be your opioid statistics that you're looking for. Next slide. Oh, unless Blake, if you have anything to offer.
I was just going to say the one comment on I'll make less money. It's flippant, but it's what a lot of people will think. But again, when you're coming into these offices, you're thinking about how this is going to change their district. How is this going to change the general population's access to care? Because
That's
really,
right.
as providers, we should care more about that than we do about caring about money. Should being the operative word. We have to care about money, obviously. Medicine is a business, but when and if they ask you that question, it is how this will benefit and positively impact their district.
Right. So we want you talking not just about the bottom line for you. And guys, I've done both. I've taken insurance, and I didn't start out taking insurance. I went to a school that didn't spend a lot of time really teaching it or encouraging it. And I was in a state in which acupuncture was considered an essential health benefit anyway. And so I made the decision to take insurance, not because I needed my practice to expand, but because it really dawned on me one day that for some people, insurance coverage is the only way they're ever going to experience this medicine. And that actually broke my heart, the idea of people not experiencing this medicine. At the end of the day, we are looking for how, and so are your legislators, by the way, so are your congressional staff members. Make sure that you present patient forward, because, and that's why patient testimonials are so powerful, is even though we're talking about a law that changing it would include us in reimbursement, the patients, that's never the issue. And so sometimes the provider groups, I don't know, they may come across as greedy. That's sometimes an issue. It's not true, I don't think, but it is sometimes how we appear. If we appear patient forward, and we are patient forward, and I do believe that about the vast majority of acupuncturists that I know, and I know a lot of them, that we really do care about this medicine being available to as many, the vast majority of people. So, so yeah, but thank you for that, Blake. I appreciate it. Next slide, please. All right, this is what we provide for you guys. That graph will stay the same. It's the Know Your Practitioner. There's some wording that will change in the words of Know Your Practitioner that's going to be state specific. This one is particular to California. California has some different requirements to be licensed acupuncturists because they are also considered primary care. And so that's not true in every state. We want to make sure we get it right, but we will provide that for you. And then as you see, there's a state map and it has a breakdown of each district and the number of acupuncturists in it. It's just a pretty little graphic. People can either include this stuff or not. We felt like it was important to include. And so we have a 2-pager instead of a 1-pager that is heavy on the graphics. We are keeping our messaging simple. All of that stuff is going to be eye-popping and something that they can refer to, but obviously the content will expand as you go into these meetings, and you'll make the determination of how best to present this information. This is merely your what should we call it, Blake? Your this is just your initial messaging, right? Okay. Blake, do you have anything to offer?
No, I don't. Just know, like, this is modifiable. This is customizable to your own individualized approach. So
right, but also we will create these for you. We're actually, when we say research, we're just asking you to answer some questions so that we can put these into infographics for you. Nobody is going to be required to get in there and reproduce something in Canva or whatever on their own. We just are asking for the details for your part of the research, and then we'll plug them in and get those back to you.
exactly.
Okay. All right, next slide. We had this in the last one. Like I said, this is the very top of that 2-pager. It includes the CMS guidelines. It includes the bill, and you're going to want to know that. Blake touched on it earlier, that they're going to want to know how many people have co-sponsored. They really are going to want to know how many of their particular partisanship has co-sponsored, which is why it becomes really important to do this in a manner in which we are never uploading our Democrats or our Republicans too fast and too heavy, because if it gets to a certain point where it's overloaded with one or the other, as contentious as it is on the Hill right now, that can make your bill dead on arrival. That being said, we're trying to strip this language anyway, so honestly, that rule may not apply this time. I still will always go for bipartisanship in a bill, but again, if we're looking to strip it, sometimes 100 co-sponsors is 100 co-sponsors, and that's really it. If you were meeting in person, and obviously they can't click on this, if you're handing them the paper, we would have included both the CMS guidelines and the bill. However, these days, before you ever get there, they're going to have this in their hand anyway. We are going to send that as part of the materials to them for each office before you sit down. And that way, you don't have to do anything other than present. Okay? Over the technology every time because it's important. Basecamp. I don't think it's like Beetlejuice. Basecamp didn't just appear for everybody, right? So that is where I work. That is where Blake works. That's where AcuCongress will always congregate. And we do recommend telling, because headquarters, this is free to join, training is always free. Please get your colleagues involved. We can't do this alone, and you guys need each other in order to do that. We are building a beloved community. Basecamp is an excellent way to do that. Zoom calls, I think everybody's familiar with. We're on one right now. Finally, we'll go over Congress Plus in detail. The next time we meet will be in person. For those of you not going to the symposium, it's totally okay. We may actually rig it where you can join a Zoom call during that time. I haven't figured that out yet, but that's the goal. Regardless, the whole meeting will be recorded, and we will strip that out and make that available to anybody who cannot come, because we're going to go over messaging very, very clearly, also techniques, but primarily we're going to be going over the app and what to expect and the timing and how this looks, because we'll be exactly 1 month out. I can't really start booking. I'll try, but I got tired of being yelled at by congressional staff members a long time ago when I tried to book appointments more than 2 weeks out. And so you just have to figure the 2 weeks leading into that. I will be an insane person, working basically 18-hour days, trying to make sure that things are done. Recognize that once these appointments are set up, that is not a guarantee that that's even going to be the time that it happens. Oftentimes that is going to change dramatically, maybe often. I know that sounds horrible to a lot of people who really are, that value their time management, but we are asking everyone just to take the day off and get involved. Once you have your schedule, if you determine that, no, you can't afford to take the day off, you're not going to do that. And I know that people are worried about the time management of their patients, who, by the way, are probably not going to sit in on your Senate meetings because the constituency base is already too large. I think the last time, Blake, how many did we have in the California meetings? 73, 75?
Something like that, yeah.
Yeah. The beauty of virtual meetings, by the way, is we can put 75 people in a meeting. You can fit 12 on Capitol Hill. And so if you have 75 people show up for a Senate meeting, most of them are not going to be able to go in, much less speak. And they're not going to meet with all of them staggered across the day. So you kind of just have to pick the 12. District meetings, usually there's only enough space for 4. And so virtual meetings have actually opened the door to making sure that we can have patients there, and they are incredibly impactful. So I would say that virtual fly-ins or some hybrid thereof are the wave of the future. So we'll get into, I know I keep saying it, we will get into Congress Plus in great detail. You will not have any questions. And I know there are lots and lots of people out there. I hear from one of my ASME members all the time. He's amazing. Absolutely adore him. And he wants to know everything about everything. And I get it, because I'm the same way. But as I told him, Blake and I layer this for a reason. We want this information to be digestible. We want you to chunk it down and compartmentalize. And so if you'll bear with us, there is a method to our madness. We want everybody to understand the ins and outs of these techniques. We're not just arming you with some materials and then telling you what to say and having you just go in and regurgitate. This really is about building relationships inside of the district with these offices, with your senators, with your House of Representatives, and having a sustainable influence, and making sure that, this isn't a one-off, that we are creating this dance with them, and that will continue afterwards. Blake, do you have anything to offer on the technology?
Nope.
Yep.
Can't wait to see y'all on Basecamp. Basecamp.
Exactly. Basecamp. Okay, so that's so far as the plan. That is the deep district dive that we are going to do today. The next time that we meet, we're skipping next week, quite honestly, because I'm going into the Atlantic Symposium Convention, and we'll be teaching there. And given health concerns in the last couple of weeks, I probably just need to take that week off and prepare. We are always in Basecamp, and you can ask your questions or find anything that you need there. The next time that we meet, we'll talk about messaging, and we touched a little bit on it today, but we're going to make sure that you guys are moved into your state teams, that probably by next week, and that you'll have district folders that you can access, and that everybody has their messaging in front of them by the time we hit Atlantic Symposium and the next time that we meet, which would be November 8th, Monday, November 8th, and Tuesday, November 9th. We will have the office of Judy Chu join us at the Atlantic Symposium. And joining the stage with me to train will be both Blake Langley and Michelle Lau from the AAOA. So I'm very excited about what we're going to be doing on stage there.